Hi, my name's Kayla. I'm going to perform skills video prenatal education precautions, which includes what to avoid during pregnancy. So first, I'm going to perform hand hygiene. I'm going to enter the patient's room and provide privacy. I'll introduce myself to the patient and ask them their name and date of birth and verify checking their wristband. I'll explain to them that I'm going to be going over what to avoid and what is okay during pregnancy. So first thing we're going to discuss is what foods to avoid, and that includes mercury-rich foods such as tuna and sushi. This can cause complications in your pregnancy and birth defects. So you also want to avoid eating undercooked meat such as poultry and pork, which can cause food-related illnesses that will harm the baby. You also want to avoid lunch meats because of the risk of listeria. You also want to avoid unwashed produce because of listeria or E. coli. What you want to do with your produce as soon as you get it home is wash it really well. Things that you can take during pregnancy are over-the-counter medications and supplements. So it's okay to take acetaminophen, also known as Tylenol, for pain. You can take Tums for indigestion or heartburn. It's okay to take Claritin for allergies. And you definitely want to take folic acid. So it's found in prenatal pills. Folic acid is important to prevent neurotube defects in the fetus. You want to take prenatal vitamins and make sure they contain calcium and iron as well. And you can also eat iron-rich foods such as leafy greens like spinach or kale. Some things you want to avoid are environmental exposures such as cleaning, chemicals, and secondhand smoke. This can cause preterm birth or low birth weight. Avoid pesticides and coming in contact with lead, which is also known to cause birth defects. And one of the main things you want to avoid are alcohol and tobacco. And there's absolutely no safe amount of it that you can consume during pregnancy. Alcohol can cause brain damage, fetal alcohol syndrome, miscarriage, preterm birth, low birth weight, and tobacco can also cause low birth weight, preterm birth, and miscarriage. You must also avoid all recreational drugs. So anything the mother ingests, the baby also ingests. So it's okay to travel during pregnancy, but it's recommended that you do so before your third trimester, and of course inform your doctor. In case there's any vaccines that you might need, especially if you're going out of the country. It's okay to visit the dentist as long as you wait until after the second trimester, and if you need any procedures done, it's recommended you wait until after your delivery. If it's an emergency, you should get permission from your doctor. And if you have any questions or concerns, it's always a good idea to call your doctor.